All right. All right, everybody. Okay, hi to everyone who has already logged in. Welcome, welcome, welcome. Hi, guys. For whoever is already on, I logged in a minute early just to kind of get everything going. And I'm going to keep kind of saying welcome and hello to everybody just as people start to come on in the next couple minutes. And once it seems like there's a fair number, then we'll really start talking. But as we're logging in, I'm going to introduce myself a couple of times. And if you guys feel comfortable, shoot me a quick message and just tell me who you are, where you're from, if you're pregnant, if you're trying to get pregnant, and maybe how many weeks you are, any information you feel like you want to share. But a little bit about me, and again, like I said, I'm just going to keep repeating a couple of these things until more people are on, because I think 200 people signed up, but they're only allowing 150 people on this. So once we get to a couple more people, then we'll get into the meat of it. I don't know where everyone else is, but I am here in Connecticut where it is pouring rain. I'm looking out my window, thunder, lightning, and a ton of rain. I'm here in my office. I'm Sheiva Gohfreny. I'm an OBGYN in Connecticut. I am on Instagram a lot, so I don't know if any of you guys follow me, but I am purposefully here to really try to increase all of your knowledge so that I can decrease your anxiety. Like that's truly, truly the purpose of why I like to do these types of things. And as I joke, I don't do it selflessly because, oh my gosh, it's just what I want to be doing. I do it because it actually makes my job easier. The more and more I find that you guys understand about yourselves and your body and your health, the easier my job is as the doctor to really understand how to help you without it meaning that I have to kind of overdo explaining everything too many times. Because if you guys tend to really get it, then we both can come to a conclusion together. So as more people come on, we're going to discuss details about COVID. If you guys have questions, then do me a favor and just shoot them out here. And if you can either put them in the chat or the Q&A, I don't know what's easier. I can keep both of them in. Hello, Joanna from, Mesa, Arizona, 33 weeks and breast cancer. And Ellen, 33 weeks breast cancer from Joanna, congrats. Ellen, 11 weeks. Melissa, hello, I love you and I know you well. And Kay Walsh. Okay, you guys, I love that you guys are all putting this out. Let me say a couple things about myself because Joanna just reminded me that I wanted to tell you guys about me a little bit before more people come on. I'm an OBGYN for 21 years. I want to give you perspective on where I come from with all of this because medically speaking, it's very easy for all of us to learn this information. A lot of the way I instruct my patients has to do with where I come from medically myself. So I myself had ovarian cancer. So Joanna, I'm so glad to hear that you're doing well with breast cancer and that now you're pregnant. 4 years ago, I had ovarian cancer. In addition, I've been through miscarriages. I had 1 vaginal delivery. I've had 2 C-sections. I've had a lot of OBGYN stuff in general. And it's actually helped me so much understand the mindset and anxiety of what we go through as women. And what I've really found is this. We are so strong, you guys. Women are amazing. We can withstand and go through so much, but we make the mistake really often of saying things or even thinking things like, well, everything's going to be completely fine, right? And what we really mean is not everything's going to be perfect, right? Because when we say that or think it or imply it to the people around us, then everyone else kind of feels like they have to shuffle and pretend like things are perfect. And we know things are not perfect. What we really mean is we all want to be okay in the end. We all want to survive and we all want to generally live good, happy lives. But within that mode of survival and living generally good, happy lives, we know that things are going to happen. And while I don't want to say that in a doomsday way, I actually want to say that in a very realistic way. When I look at my last 50 years of my life, particularly my last 20 years of my life, I've been through a lot of stuff between the miscarriages and deliveries and babies and C-sections and ovarian cancer. And had I gone into it going, oh my gosh, if any of these things happened, then that must mean my life is terrible, I would be devastated right now. But I'm not, because despite all of those things, I have a great life. So my overarching imploration to you guys, I'm begging you guys to look at it as, don't kind of approach everything, especially when it comes to COVID, with, oh my gosh, I just need to hear that everything is going to be perfect, because nothing is going to be perfect. The one thing I can guarantee you is that nothing's going to be perfect. But the one thing that I can tell you is that warts and all, most of us get through our life generally happy if we view it as overall our our life is a journey of different things that can happen. And we kind of have to look at it that way, because if not, we're going to be riddled with anxiety over all of these little things that happen. And I'm sure that all of you on here, certainly Joanna, who's gone through breast cancer before having a baby, certainly anyone else on here who's gone through all kinds of issues, I think understands that. So one of the many things that I kind of instruct my patients is, don't ever ask a doctor what is possible, ask us what is probable. The probability for all of you out there, without me even looking at how far you are or anything, is that you are going to deliver a baby who is overall probably going to be fine. Now, does that mean things are going to be perfect? No. And again, just to give you a nugget, I have a 16-year-old son who I had a very challenging delivery with, and he actually had an intrauterine stroke. Was that fine? No, it wasn't. But is he overall fine? Yes. Did we have issues? Do we still have issues? Yes. But he's overall a healthy 16-year-old boy. So we have to remind ourselves that what we consider okay in the long run is actually much broader than what we want when we're focusing on the future. And that's a really big issue, because we are much happier when we look back on things like, look, everything was ended up great. But when we look to the future, we expect things to be perfect, and they almost never are. Okay, so all that mindset aside, I want us to talk about COVID, and you guys had sent in some questions, and then any questions you have, you can certainly send in here, okay? So let me just scroll down for a sec if anyone's asking any specific questions yet. So I want everyone, if you don't have a pen, grab a pen, because one of the best books I have ever written for pregnancy is by a woman named Emily Oster. So if you have not read Emily Oster, she is an economist who wrote a book called Expecting Better. And it's very calming. It is not like all of these other books that unfortunately really incite anxiety in all of us. Pregnancy, being a woman, is a generally anxiety-provoking part of our world, right? And so when we're pregnant, we go online and we read all kinds of possibilities of what could happen, and that just makes us nervous. She really distills the facts, and she doesn't do it in a way that sounds fake. She looks at all of the actual data from an economist point of view, and tells you where some of the data that even us as doctors are telling you that is not correct. So I want you to read it. Obviously, you have to follow what your doctor says. I am not your doctor, so please follow what your doctor says, unless I am your doctor. But I'm telling you that it's a very impactful book. And she actually has a website called explaincovid.org, explaincovid.org, that also describes everything about COVID and distills all of the news information. So everything that you keep hearing on Facebook and CNN and all of the different news media outlets that unfortunately inflate and conflate and cause a lot of anxiety, she will distill the facts, again, accurately, but to help you feel less angst about it. Okay, I wish I could see you guys so you could raise your hand and be like, yeah, I get it, or not, but you can't. So I'm gonna keep talking about these things. A couple of things that have come up that I wanted to write notes about, because I think in the last particular 2 to 3 weeks, there's been a lot of news issues that people keep sending me messages about that they've gotten anxious about. Let's talk about COVID in general. As a virus, we know that pregnant women are more susceptible to complications from viruses. Like if I get the flu virus, for example, as a non-pregnant woman versus any of you who are pregnant, you are unfortunately more likely to have more complications than I would have. We know that as a fact because pregnant women are more likely to have a lower immune system. When we got into COVID, we assumed that would be the case with women and children, and we were actually very happily surprised initially that we were not seeing as dire consequences with pregnant women as we had thought we would. In June-ish, the early part of June or mid part of June, the CDC came out with a lot of data kind of confirming what we had initially suspected, that in fact, pregnant women were faring worse, meaning hospitalizations and ICU admissions and intubations were actually higher with pregnant women when they looked at all the data. So it confirmed what we had initially suspected, not what we necessarily had all anecdotally seen, but what we had suspected. So we were not surprised. When people kept sending me messages and freaking out and being anxious and nervous, we weren't shocked about it because it's what we had thought. The good news was that pregnant women were not dying at a higher rate than non-pregnant women with COVID. And some of the data might be skewed because when you're pregnant, we are much more apt to be more cautious in how we treat you. And you're frankly more apt to just have a physician. So when you're a pregnant woman with COVID, you're more likely to be hospitalized than a non-pregnant woman with COVID because we are just going to treat you more cautiously. So it's hard to say that that hospitalizations alone with COVID mean that it's always going to be worse. The most concerning part to me about COVID is frankly the unknown, but I repeat this over and over to my patients that at least now we have from, let's say, March alone, not counting even before March where we have some data, but if we just count from March to now, we have a lot of decent data telling us that yes, there have been some untoward incidents with pregnant women, with unborn babies, and with things like miscarriages. But again, the rate has not been as high as what we had been concerned about, okay? So that is a really important, very overarching theme that I want us all to remember, that while we have to proceed with caution, we can't sit here and say, oh my God, pregnancy means so much destruction and COVID is going to make everything worse, because so far that has not been borne out in the data. Yes, we can keep saying that we don't have a ton of data, but anecdotally, and now with communication really being every minute to minute, we know throughout the world that we are not seeing wildly high rates of fetal demises or other problems like really high rates of miscarriages or really high rates of preeclampsia and things like that with COVID. The reason I bring those three things up, so fetal demise and preeclampsia, which is where you have high blood pressure during pregnancy, or miscarriages, those are the three items that it does seem anecdotally like there might be a slightly higher incidence of. Those three things are obviously very, very unfortunate, and we hope that there is not an actual higher chance and that it might just be biased because we're all paying more attention to it. But those are the things that they're looking at. And even if there is a slightly higher chance, it's certainly not an aggressively high number. So when patients come to us and say, oh my gosh, I have heard that this is possibly true, that there might be a slightly higher chance, should I not get pregnant? It's really hard for any of us to tell you not to get pregnant right now because this is not a short period of time. This is not something that's going to end in 2, 3, 4 months. So to delay your childbearing for an indefinite period of time where we can't give you an answer for something that might be slightly higher, you see how it seems like we don't need to get that anxious about it. So if you said to your doctor, is it possible that COVID increases the risk of a miscarriage or increases the risk of things that are really unfortunate? The answer is yes, it is possible. Is it probable that that will happen in any one patient? The answer is overwhelmingly no. So again, I don't want to falsely paint the rosy picture of everything's fine, it's not a big deal, go ahead, get pregnant, don't think about it. But I do want to be very measured and very cautious and very optimistic in saying the likelihood of any one person having anything devastating is still relatively small. Does that mean that you shouldn't take precautions? No. Anyone who is in my practice or knows me socially knows that I am very proactive. One of the other isms I always say is I want us all to be proactive without being paranoid. What that means to me is aggressively wearing a mask whenever you can. I have like a pile of masks here, so I'm always wearing a mask in my office. I'm constantly washing my hands, and I was not a germaphobe before. I was one of the doctors who did not care. I probably would have eaten off the floor. It would not have bothered me. But I wash my hands a lot. I'm very mindful when I have my mask on not to touch the outside of my mask. And if I do notice that I've touched it, I wash my hands again, because you don't want to be touching the outside of your mask, touching your face, and then touching your eyes or anything else. I'm very mindful whenever I can of not even touching door handles. If I'm in bathrooms where there is a toilet lid seat, I close the lid. So anytime I can decrease my exposure without making myself feel too anxious, because we have to remember, we can't measure the effect of anxiety and stress on our cortisol levels, but we know that it's there. We know that the more anxiety and the more stress you cause yourself, the more your cortisol levels rise. Now, even saying that, I think sometimes makes someone's cortisol level rise, so I don't want to do that, but I want everyone to approach this with as much calm as they possibly can without being too blasé about it, right? I don't want to say to you guys, go ahead, don't wash your hands, don't wear masks, go in crowded places. But I also don't want you to absolutely isolate yourself so much to the degree that it causes emotional distress, anxiety, and depression, because that's not healthy either. So I know there's some questions about probably going back to work and everything. So some of the questions that patients had as far as what they should do for people coming to visit them. So I'm going to go through a couple of these, and they're in different order. One person had asked, are there any known threatening complications for the fetus if the mom contracts COVID-19 without severe symptoms? Well, interestingly, we don't know if there's any difference between when a mom has COVID with severe symptoms versus not. Meaning, let's say there's a mom who just has mild COVID versus a mom who actually has COVID and needs to be intubated. The one glaring difference is if you have COVID and get intubated, there is a decent chance you're going to end up having to have a delivery, like a preterm delivery, preterm labor that you might go into, or that for reasons of difficulty with breathing, we might have to deliver the baby. That doesn't mean that the COVID has affected the pregnancy. That just means that your inability to breathe well or the inability of being intubated and being able to actually get enough oxygen might force the doctors to deliver your baby early. But does it actually preferentially affect the baby differently? And the answer is so far, it doesn't seem so. So I cannot say yes or no, but anecdotally, it doesn't seem as though the severity of the COVID affects the baby either way. The way the question is phrased, though, is what I want you to really listen to. The question was, are there known threatening complications? And this is where, again, I want us to think of how words affect our anxiety levels. Threatening complications sounds so onerous. I'd like to rephrase it as, are there any complications that we need to be concerned about? And the answer is, there is always a possibility of a miscarriage, of preeclampsia, of events that can happen in a pregnancy. The likelihood of COVID causing those problems right now is unknown. Is it possible that it is a slightly higher risk? Maybe. Is it likely? No. So again, there is a very big difference. And for any of you who is considering getting pregnant, if you feel like, well, I could wait a year or two and it's not going to affect me, then by all means, great, wait a year or two. But if you don't have that luxury, which most of us do not, I think pushing it off an extra couple of months is not necessarily something that most OBGYNs would tell you to do right now, because we don't necessarily know that we're going to have that much more information even in the next couple months. Okay, I hope that makes sense. Next question. I've heard some recommendations that after delivery, new parents should quarantine before having their family come visit and help due to the risk of giving their family COVID, meaning you've gone to the hospital, you've delivered, and now should you quarantine? So I want to combine that with a couple of the other questions, because these were questions about labor and delivery. For example, do you need to wear a mask when you're giving birth? Can you only stay in your room when you're in labor at the hospital? And there were some breastfeeding questions. So let's talk about what happens when you get to the hospital. Each hospital is a little bit different, so I will comment on what I know about my hospital and what I've heard from other hospitals, from a lot of the other doctors that I'm in contact with. At our hospital, you come in if you are deemed to be in labor or having a C-section, as opposed to having a rule-out labor situation. Then your partner waits in the waiting room and you get tested. Typically right now it's the nasal swab, sometimes it's the oral swab. And most of the time the test will come back in 30 minutes. So you go into the room, your partner waits in the waiting room, you get tested, and then once you are negative, your partner is allowed to come in with you. At our hospital, you do not have to wear a mask once you're negative, but at many hospitals, they will still ask you to wear a mask, because there are some false negatives, and because they want to make sure that you are still being protected by two layers, meaning all the staff members are going to be masked, but if you have a mask on, that's even more protection for you. Your partner, at least at our hospital, does not get tested, mostly because they just don't have the capacity to test all of the partners. Some hospitals might also test the partners, and then that will differ as to whether or not they'd allow your partner to stay or not. In our hospital, again, the partners are all masked. Some of the hospitals, if the partner is negative, might allow the partner to take off the mask, but that's rare, because you have to remember that even with testing, we know that there are false negatives. So by and large, if you can continue to wear the mask, it will probably make sense, though it is a little bit hospital dependent, as I said. And as you can imagine, it's hard to continue to wear a mask when you're in labor and certainly when you are pushing. If you are positive, so let's say you walk in with no symptoms and you are found to be positive, which has happened, and there are only rare circumstances of false positives. So if you are found to be positive, the chances it's probably a true positive or you were asymptomatic. Then many hospitals will unfortunately not allow you to have your partner be with you in the room. This is one of the reasons that even though there's no strict guideline, I tend to encourage my patients, if they can, the last couple weeks before their delivery, if nothing else but for logistics, try to decrease the amount of exposure you have. It's not always easy because some of them have jobs where they can't do that. But in those situations where they do have a job where they can be home more, maybe for that last 2 or 3 weeks, not necessarily because of safety, not because I'm necessarily worried, but merely because of the chance of exposure without them knowing it, and then showing up at the hospital with a positive, which will upset them because then they will not be able to necessarily have to partner with them. I think it would be best to try to spend less time, for example, in an office setting where you could be exposed. So again, if that's possible, it's something you could talk about with your physician. Now, what happens when you go home? Because you're at the hospital and you're potentially being exposed to doctors, nurses, techs, aides, and things like that. Well, first of all, pretty much globally, all of those people are being masked. So the likelihood of them giving you anything is very small. Though, for the most part, these people, like we, are not being routinely tested. There is no mechanism in place for us to be routinely tested. That would lead to a public health nightmare so far. So there is always that small chance that you get tested at the hospital, you come in negative, but you pick it up at the hospital and take it home. Is that likely? Doesn't seem so, but it is possible. So you have to kind of individualize. If your mom is going to come and help you, but she unfortunately has other problems like something that causes her to have a lot of autoimmune issues and a very low immune system, or she happens to be on chemotherapy or something, then you might really want to consider having her stay away for 2 weeks. Would I by and large say that to everyone? I personally wouldn't. And again, I encourage you to talk to your doctors, but I've said to my own patients, I would love for your families or whoever is going to come take care of you and the baby to kind of be somewhat socially distant for the previous 2 weeks before they come see you, just to decrease the chance that they're going to bring anything to you. And if they can get tested, that's that much better, but I wouldn't say that's a requirement. And I would love, in a perfect world, if you could spend a couple of days on your own when you get back from the hospital and then have them come see you. But in the real world, you need help. You need sleep when you come home from the hospital. You need sleep to help you heal. And you need your mother, your mother-in-law, a friend, a birth doula, a postpartum doula, anyone you can who can actually just help give you some sleep and some rest. So I would personally say, I don't think you need to quarantine away from them for their sake or your sake, unless there are particular instances where they are very immune compromised, which is that's a kind of separate situation. Are you only allowed to stay in your room? Again, it's very hospital dependent. Our hospital pretty much wants you to stay in your room. They allow your partner to stay with you. They don't force your partner to never leave the room and, for example, not go back home. But they really try to encourage him or her to stay with you, because if they're going back and forth to your house, for example, there's always that chance that every time they leave, they're bringing something back. So again, it depends on the hospital. Some hospitals are more strict than others. Ours is fairly open with letting the partners leave and come back, but they really try to discourage it. The one thing you should know is that once your partner is the partner who's going to be with you, at least again at our hospital, that is the only person that gets to stay with you the entire time. You can't have your partner there during the delivery and then switch it out to, for example, your mother or your friend the next day. They don't allow for that. Okay. As far as trying to conceive, someone had said, I'm going to start trying to conceive soon. Am I crazy or should I wait? And the answer, I think you guys can tell from how I already speak, is no, you're not crazy. I think it is, and I'm just going to keep reiterating this, a really anxiety-provoking situation in general, because that's what pregnancy does to us normally, and add COVID for everybody. People are feeling anxiety. I actually posted about it today on Instagram, just anxiety in general that I'm feeling. But I don't want anyone to approach this as one of those situations where all they can do is think about the worst case scenarios, because the worst case scenarios are unlikely to happen. Do they happen sometimes? Of course they do. Probably every one of us on this panel right now can either cite personal instances of things that we never thought would happen that were our worst case scenario, or know someone who went through it. But we've still either shown up and gotten through it, or those other people have shown up and gotten through it. So again, we have to remind ourselves that when we even think of those worst case scenarios, we by and large are able to weather things, and they don't often happen. Okay. So I just want everyone to kind of marinate with that and really sit with that idea, because I think that is something that we don't think about enough in our lives. I say to my patients often things like, I never promised you a rose garden. When I say everything's going to be okay, it doesn't mean everything's going to be perfect up until it's okay. It means that globally we're going to get through it. I often actually say, even to my kids, which might sound really mean because my kids are only 16 and 12 and 9, but I say to them, I got to tell you kids, shit is going to happen in your life. I don't want to sugarcoat it. The more I can prepare you that things will happen without being negative and doomsday, the more I can say to you, I need to help you be independent and resilient so that when those things happen, you can actually be upset, be sad, cry, be anxious, but still know that you're going to move on and be okay, and be happy in the end. I feel like I'll be able to guide you better if I kind of lead you into a life where I make you think that everything is going to be perfect, that you're going to have the perfect pregnancy and the perfect delivery and everything's going to be wonderful. Then I have unfortunately lost all faith, I think, from your perspective of me, because it rarely goes that way. And if you take a second to reflect on your life and think of all the things that went wrong in your life that you didn't think would go wrong, but that you still ended up wherever you are right now, which probably is pretty good, it's a good way to remind yourself that you actually can go through a lot. I know women, and women can do amazing, amazing things, right? So I just want to go through a couple of these. I love that you guys have been giving me all of these things. So I'm going to listen up some of these things that people have been writing. Kay Walsh said she tested positive 2 times for the antibodies and never had any serious symptoms. Well, first of all, Kay Walsh, good job that you have your antibodies, because then after the pregnancy is done, you can actually donate. So I'm glad. All right. How long do you think we should quarantine before the baby is born, or do you think it's not necessary? Okay. So I hope I answered that, but I would say in a perfect world, anytime after like 35, 36 weeks, if you can not quarantine, like completely isolate yourself, but just really try to decrease any type of contact with groups of people. And 35 weeks, again, is probably aggressive. Like I said to 2 or 3 patients today who couldn't stop working at 35 weeks, but they could stop at about 37, 38 weeks. So there's no rule. In London, there actually are rules about healthcare workers stopping after 26 to 28 weeks, or pregnant women in general who are going to be exposed to high-risk places. In America, we don't have that rule. So I would say it really depends. I don't want to add the burden to a woman who absolutely has to work because she's the one who's paying for rent, for example, and say to her, you need to be home isolated, because the anxiety of not being able to pay her rent, I guarantee, is going to be far worse than the potential exposure of COVID, right? So we have to balance everything. All things being perfect and equal, if you could stop being exposed at about 35, 36 weeks without causing yourself too much anxiety, I think that would be delightful, delightful. Oh, hello, Megan Bertoni, new to our practice. Oh, I know who you are, Megan Bertoni. Okay. All right. So tell me, you guys, it's so funny because I'm not used to Zoom. So I have 2 different places to look. Okay. Thoughts about a close friend watching a toddler son while I'm in the hospital. I'm having a repeat C-section and I'm worried to not have help afterwards. I don't know if I'm able to ask her to take a test. Ooh, Meredith, that is a tough one. So Meredith asked, I think this is Meredith's question. Should she ask her friend to take a test before watching her toddler when she's at the hospital? Again, guys, this is the type of thing where I think a lot of this, there's no right answers. I think it's like you kind of know your families and you know your friends and you know where you're going to kind of bust relations or not. My view of it is this. I think that when you're asking people for favors, you have to be wise in how you do it and who you ask. If your friend is someone who you think has taken a lot of risks and is out at the bars partying, probably not the best person to choose. But if she's been fairly mature in how she's approached things and she has not been too exposed, I don't think that it's worth asking her to take the test, because the frank truth is, if she turns out positive, do you have other alternatives? And are you just going to increase your own anxiety and potentially cause difficulty in the relationship with her? Again, if it's easy for her to get tested, great. But if it's going to cause a lot of anxiety for you and her without you thinking it's likely she has it, without you having an alternative, then I can't say I think you need to do it. Does that make sense? I mean, that's kind of how I'm always going to answer these questions, is there's no right answer. And we have to think through all the permutations of whether or not doing something is going to cause more harm or not, especially in a situation like this, where we don't have a concrete answer as to whether or not it's going to be a problem. We know, well, I should say, I know this, and I'm hoping you guys have heard this since y'all are Googling all the time. I hope you've Googled this part. By and large, children do not seem to be a vector as much as we had been concerned about. That doesn't mean children don't get it. I know there are very anxiety-provoking news reports of the issues that children can get, but again, those things are rare. So, should you be cautious with your children? Absolutely. Should you be cautious with a newborn and as a pregnant woman, because you are in a situation where we have to be a little bit more nuanced because we don't know exactly what's going to happen? Absolutely. But the data so far has been pretty good, and children don't seem to be the vector as much as we had thought. So I think, I don't think that I would make her do a test unless it's easy. That's my answer. I don't know what's the right answer, but that's what I'm saying. All right, how should we be living day to day as a pregnant woman during this time other than masks, washing hands? Fortunately, I do not have to go to an office, nor does my husband or anything of the sort, but should I be essentially isolating? No grocery store errands. Great question. Okay, have a toddler at home. So she is generally asking, what should you be doing as a pregnant woman? If you don't have to go to work, if your husband doesn't have to go to work, what do I think you should be doing? And let's remember to everyone, this is where I'm going to CYA and say, I am not your doctor, ask your doctor. I am not in charge of the CDC. These are just my opinions, right? My view is, and I said this earlier, and I don't know how many of you are just joining now, I always want to be proactive without being paranoid. And what that boils down to is this. If you're being proactive, that means you are frequently hand washing, frequently cognizantly not touching your face and your nose and your mouth and your eyes, because that is how they think that we still can get the virus into our system. That's still debatable, but let's assume that it is true for now. Frequently making sure that you're not touching your mask, because I see people doing that all the time. I'm just going to put on a mask and just show you what people are doing in my office all the time that is completely wrong. They have on their mask and they're doing this. They're doing this. They're doing this. They're eating with their mask. They're touching their mask and then they're touching their face. These are the things that are falsely giving you a sense that you're okay and they're actually maybe going to infect you. So when you put on your mask, put it on. And then if you're going to take it off, flip it over, put it down on a place that you know is clean and try not to touch the outside. And if you have touched the outside, then try to make a concerted effort not to touch your face until you wash your hands. As far as how much should you actually isolate yourself, if you feel that you can really distance yourself and still remain sane, then I think it's wonderful. If this can be a time where you say, you know what, I'm never going to have this time back. I'm never going to have this time at home with my toddler and my husband where I actually get to bake bread and do things that people keep telling me they're doing that I never get to do, then I think that's wonderful. If, on the other hand, the notion of being completely at home, alone and isolated with no one else makes you feel anxious and depressed, then I would argue that the cortisol stress reaction and what that's going to cause to your immune system is going to be more detrimental. Now, that doesn't mean go to a bar. That means find the few people that you think are also being responsible and spend time ideally outdoors. They've shown by and large that being outdoors decreases your risk compared to being indoors. So indoors, smaller spaces, closer quarters, places where there's poor circulation, like office settings where you're not going in and out of these places, but you're in one office setting for a long time, are absolutely going to be, unfortunately, the vectors where people are going to be getting more sick. So we're going to probably see that in the fall when people start going back to work, and fall and winter where people are just going to be inside. Those are the places that I would try to avoid. But if you can be calm about seeing a couple of people just so you still feel connected without being overly exposed to too many people in tight quarters, I think you're okay. I just heard the last 2 days that there was, without giving away too many identifiers, but a town nearby, there were a group of 20-something-year-olds at one of the islands nearby in Massachusetts, and I think there was another big outbreak. And I'm sure it was dozens of 20-something-year-olds who were in very close proximity partying together. So do I think that that is wise? No. Do I think that we can control what the 20-somethings are going to do? No. So would I go to the home of a friend who has a ton of 20-year-olds partying in her home? I wouldn't. So I think you really have to pick and choose where you're going to kind of allow yourself to be exposed, but I don't think it means you have to be home isolated the entire time. Because again, I think that the benefits to that might not outweigh, I think the benefits to not getting COVID might not outweigh the anxiety. Okay, Lourdes is saying she's 22 weeks. Her due date's in November. She's a New York resident. She came down to Charlotte in April when she found out she was pregnant. April Fool's, she says. She's undecided about when to return to New York. What are your thoughts on the probability of wave 2 taking place in the fall, and where may be a better place to deliver, New York City versus outside of New York City? I know it's a tough question. Yes, you're right. It is a tough question. I have to tell you, I love New York City, and I am mourning my sadness about what is happening in New York City. I think that, to be honest, we have no idea about the second wave, right? I think that there is a decent chance that we're going to see at least a little bit of resurgence. We don't know how many of us have enough antibodies to protect ourselves. So I think that we have to be clear that there is a very, very decent chance that we'll see more of it in the fall and winter. I think going back to New York City, if you don't have to, is probably something I would avoid. Now, all that said, New York City, in a way, is that place where they've already got their systems down because they were the first ones to have to deal with this. So they actually know how to wear all their PPE, how they have to deal with patients with COVID. So in a way, if you're going to pick a city, I'd much rather New York City than Miami or LA right now. But if you don't have to be in the city, you might be better off in one of the suburbs. I would say, again, I wouldn't personally necessarily move out of the city if you're there right now, but I think if you don't have to go back there, since we don't know, and you're in a position where you could pick different places, it might be easier. Also, because what I'm seeing from a lot of people who have moved out of the city to here in Connecticut, because there was this sudden need to have to stay inside, so many patients just felt, they felt like they were just too isolated, having to stay in a small apartment instead of being able to be in a place where they had more space. So it's more just the logistics as well. If a person tests positive at birth, what do you recommend for how they care for the baby? Good question, because I want to talk about the baby and nursing. And if the mother is positive and passes it to the baby, how are the babies handling COVID? Okay, so, and then there's a question about returning to work and about grandparents and NICU. I just want to see if some of these are related. Infants in the room with us, hospital policy, separating the mother when you're positive. Okay, some of these are good and all related. So when you come into the hospital, I'll just review again because we talked about this quickly, that you'll be tested. If you are negative, would you be encouraged to keep the baby in the room? Yes. Some hospitals require you to room in, assuming you are negative. Some hospitals will not allow you to send the baby to the nursery, and you have to keep the baby in your room with you. Rooming in, they call it. Our hospital, again, allows you to choose rooming in or sending the baby back to the nursery. They try to discourage sending the baby back to the nursery just so that there's not a lot of back and forth, but they certainly allow it. I have to say, I again like to balance not too much back and forth, but I also want you to get a good night's sleep when you're at the hospital, because that's kind of what you're there for. As far as if you are COVID positive, again, at our hospital, if you are COVID positive, you are not encouraged to fully separate from the baby like we had said at the beginning. At the beginning of COVID, because we did not know how this was going to be transmitted, women were unfortunately very much encouraged, almost forced to separate from the baby. And the baby was sent to the nursery completely, and women were isolated from their babies. And that sounded terrible, but unfortunately it's because they just didn't know. Now, when women are positive, they are encouraged to breastfeed. And I am very open with patients about if they want to breastfeed, I think it's wonderful. If they don't want to breastfeed, I think it's absolutely their choice. When they have COVID, that is one of the times where I really would try to encourage them to breastfeed even more, because we know that the antibodies that the mom who is pregnant will already start developing will protect the baby. And because we know that mom is going to be going home with the baby and is going to mask, frequently wash her hands, if she's going to pump, she's going to be very, very careful about making sure that she sterilizes the pump equipment and everything. But because of that exposure, even more, we would like the baby to get the passive antibodies. So we would really encourage mom to actually nurse in those cases. So do you send the baby back to the nursery or not? Again, at our hospital, if you're positive, then you either have to make a choice that you're keeping the baby the entire time, and then you cannot send the baby back even for an hour. Or if you send the baby back, then you cannot have the baby with you even for an hour. So it's all or nothing at our hospital, just again to decrease that back and forth, because as you can imagine, they have to keep you in isolation. If you've exposed your baby, then they have to keep your baby in isolation as well. So they can't have a back and forth. So net, while it makes me sad to think that you wouldn't have any time to rest at the hospital, if it were me and I had COVID and I were at the hospital, I probably would keep the baby with me. And I'm not one who keeps the babies with me. When I had my babies, I was happy with them to go to the nursery, just to be clear. But in this case, I probably would if it's all or nothing. So I hope that answers that question. Okay, what is the hospital policy on separating the baby? So that answered as far as the babies being positive. So my partner and I are starting to feel guilty for our 2 toddlers. She said one of the magic words that I love to hear so that I can give you my little lecture on guilt. So I'm gonna pause after this question and give you my little lecture on guilt and fear, which are 2 of the words I dislike the most, by the way. We're starting to feel guilty for our 2 toddlers. We've been very strictly isolating at home since mid-March. I'm 41 weeks pregnant. God bless you, love. And my 4-year-old is just starting to have challenging time missing her friends. I'm sure she's like She's just probably feeling stir crazy. Her friends, for the most part, are doing camps, etc. After I have the baby, do you think it's kind of okay to have social distance outdoor play dates, or should we really continue to isolate, and for how long? We have been very strictly isolating, and it's really starting to get to us, but we are very concerned with COVID. Okay, first of all, Caitlin, mama, did you guys understand that? Did I speak too quickly? So Caitlin has 2 toddlers and is 41 weeks pregnant. Caitlin, God bless you. You're amazing. I think that you have done a really good job by actually trying to socially distance, because I do think at the end of the pregnancy, it is a good thing to try to do. Because again, I don't know if you missed the beginning, but you don't want to walk into the hospital, suddenly find out you have a positive when you're asymptomatic, and then your partner can't be with you. So I think that's a good idea that you did what you did. I also think that, listen to me, your children, your toddlers are going to be okay. I'm sure that your baby girl is starting to get a little stir crazy, but she's going to be okay. Now, once you have the baby, can you be a little bit less austere? I mean, maybe a little bit, right? Like I talked to a woman today who is actually in charge of a nursery school, and she's going to be taking her infant back to school with her 2 days a week. Do I think that's a great idea? I think, again, net, we each have to make a decision about what amount of risk we are willing to take. So do I think that if you have friends who you know are pretty good about not being with a million people, could you allow your kids to be with like 1 or 2 other kids, just so that they have some socialization, so that they feel less isolated, and so you don't feel like you're going stir crazy? Yeah, I think that's probably okay. But should you have, a birthday party with 10 kids? Probably not. And it doesn't sound like you would jump to that because you've been so careful so far. So again, I think you guys know that my theme is constantly going to be, please don't go like all or nothing. We always have to have like a little bit of a sense of where can I be cautious but still allow myself to live? Because guys, COVID is here, at least for now. And if it's not COVID, there's always a chance in a year or 2 there's going to be a new virus. So this is like something new that we have to, I don't want to say it's the new norm, I hate that term, but we have to learn to traverse our lives within this construct. If I knew this was going to be like 3 weeks, we can all suck it up and stay home. But this might be a new way of living where we have to be cautious without, really being so isolated that we make ourselves crazy. But since you mentioned guilt, Caitlin, and any of my people who are on this might have heard me say this, guilt is a term that should be relegated, I believe, only when you have purposefully tried to cause harm to someone, okay? So if you have willfully, purposefully harmed your children, then I think maybe you should feel guilty. Though, even in those circumstances, I would argue you probably have some deep-seated psychiatric disease that you actually can't even be held guilty for, right? Outside of those circumstances, anything else that as mothers we decide to absorb as guilt, I really think is totally misplaced. I think if we want to say, listen, last week I was really mean and I yelled and I swore at my kids, I should probably examine my behavior. It was not my best mothering. But guilt is not the sentiment that I think we should allow ourselves to feel, because guilt comes laden with a lot of other very negative feelings. You, Caitlin, you're doing an amazing job. First of all, you have grown 3 humans in your body. You are 41 weeks pregnant. That is an amazing feat in and of itself. So the thought that as a woman, you feel like you need to feel guilty makes me sad. And I'm sad that society is perpetuating this for us as women. So let's all agree, please, please, please go home tonight and think about what I've said. Guilt should be relegated to those times where you have purposefully, willfully tried to harm someone. In the absence of that, do not feel guilty, okay? Maybe examine your behavior if you think it wasn't your best mothering, for example, or your best behavior. But Caitlin, this seems like it was your best behavior, your best mothering. You're doing this to protect your children. And I think you're doing a great job. I think if you were a little bit less austere, that would be okay too. But you're doing what you think is right. And I'm betting you money that you've been entertaining those kids and they've been okay. So we'll talk about fear in a few minutes too. We only have about 15 more minutes. What if we are out of the house and in society wearing a mask and we need to take frequent sips of water? I know, because you're pregnant and it's 90 degrees. That is a tough one. I've been joking that someone's got to come up with a better mask that has like a hole, but I don't know any other way to do this that is not going to contaminate you. So I happen to have my water bottle. I happen to have a mask. The only way that you can really do it, if you're wearing your mask, I wouldn't keep doing this, right? Because you're somehow going to contaminate it. I would actually full on take off your mask, try not to touch the outside, take a sip. I feel like a stewardess, by the way, and then go back, right? I think that's the only way. That's what I'm going to say. You caught me off guard, but that's what I would tell you. Okay, as a teacher, due to report back for face-to-face teaching, God bless you and God help you, honey, because that is a tough stuff. Full-time in 3 weeks. What do I recommend for working with young elementary students, aside from the usual hand washing, mask wearing, social distancing? School policy is not requiring your students to wear masks because of the age, and they have stated that social distancing doesn't really need to be followed, and they are allowing teachers to give hugs and high fives. Ellen Moeller, I don't know where you are working, but that sounds unusual. So just to reiterate, everybody, Ellen is a teacher. I don't know how old your students are, Ellen, young elementary students. I'm a little surprised because you're saying that they are hand washing, mask wearing, and social distancing, but you're saying that the teachers can give hugs. I mean, I think that just seems funny, and you're not requiring the students to wear masks. So I think, what else can I tell you to do? The one other thing you could do if you wanted to be a little bit more cautious is get a shield, those clear shields. I will tell you, because I wear them in the operating room until deliveries. They're not comfortable. They make you really hot, but that does add an extra layer of protection. The other thing that I would say, even though this is not based on tons of medical data, but there is very little harm in it, is boosting your immune system with vitamin D3, vitamin C, and absolutely good data about sleep and how good it is for your immune system. So those are basic things that I did not say at the beginning, but I hope that we're all doing. But yeah, Ellen, that's tough. I don't know if you're pregnant or not. And again, if you are pregnant and it's the end of your pregnancy, I can't say you have to stop working, but again, if you could stop the last couple of weeks before you deliver, I think it'd be a nice thing. I mean, I think it'd be nice for everyone, by the way, pregnant or not, COVID or not, but I mean, COVID or not pregnant or not. But I think otherwise, I'm a little surprised that your school seems to be a bit more liberal than most. Okay, currently 33 weeks pregnant and having slightly labored breathing for a few months, and it's worsening. She's attributing this to the pregnancy and therefore answering no when asked if she has any COVID symptoms. Is this irresponsible? And by the way, she's been isolating at home and only leaving for appointments and the rare early morning walk. Okay, that's a great question, because I'll tell you what we are concerned about when it comes to pregnancy and COVID is that when we ask patients like, do you have any shortness of breath? We actually get anxious because we know the patients are going to be like, oh my God, I'm always short of breath. And then we're like, oh, dang it. The minute someone says it, we have to respond to it. Here's what happens in pregnancy that's very common. You'll be talking on the phone. You'll have just walked up the stairs. You'll be talking to your friends a lot. And you have to stop and go and take a deep breath, because your lung capacity changes physiologically when you're pregnant. And so you'll have to breathe differently. That's normal pregnancy physiology. Unfortunately, COVID can present with very subtle, mild symptoms. So are you being irresponsible? No. Should you report those symptoms to your doctor? I think not on the phone to the secretary saying, hey, I'm short of breath, or to the nurse who's screening you. But I think when you're with the doctor, you can kind of reiterate to the doctor, listen, I'm having these symptoms where when I'm running up the stairs or when I'm talking on the phone, I kind of just have to do this. I'm assuming that's normal pregnancy stuff, just so that they understand and they can actually just make sure that there's nothing else when they're with you physically that they're concerned about. So I think that that is not a bad idea. Okay, so Ellen answered that she's in a private nonprofit, small population for students who are deaf and hard of hearing. So I'll tell you, Ellen, the other thing, if they're deaf and hard of hearing, how are you wearing a mask if they're deaf and hard of hearing? I would think that it would be better for you not to wear a mask and for you to wear a shield so that they can lip read. I'm just throwing that out there. I actually think that'd be good for all teachers to wear a mask. A shield with no mask, because then the kids can see their facial expressions. And again, depending on their distance, they probably decrease their exposure. I'm not an infectious disease doctor, but that's what I would say. I said in this that my Instagram stories to boost my immune system with vitamin D. I'm in the first trimester, and during my first phone call, I told my triage nurse I was taking 4,000 a day, and she said to stop doing this for pregnancy because they didn't want more than 2,000 a day. So Ruba had asked that in one of my Instagram stories, I had talked about 4,000 IUs of vitamin D a day, and her doctor had said they should only say 2,000. So let me again preface and cover my with saying, I am not your doctor. If I am not your doctor, please follow whatever your doctor says. I will say this, that Medical College of South Carolina has done some data about 4,000 IUs of vitamin D3 for potential prevention of preterm labor and preeclampsia. So to the degree that we can study it, which we haven't studied a lot about vitamin D, but we find that it is fairly safe. So I tell my patients that I feel comfortable with them taking 4,000 IUs of vitamin D3. There is not long-term studies, and every doctor is different. The typical prenatal vitamin will only have between 800 and 1,200 IUs. So Ruba, unfortunately, I'm going to tell you, I think you should tell your doctor and ask them what they think. I hate to do that, but that's what I have to do. Okay, so there was a couple other things that I wanted to address with you guys. Okay, prenatal visits, by the way, this is something important. This is not happening, I assume, right now as much, but right in the height of COVID, we had a lot of patients who did not want to come in for their visits because they were so scared, and I do want to address the words fear and scared. They were so scared they didn't want to come in for their visits. And of course, it was stratified a little bit between patients who were first-time moms versus second and third-time moms. First-time moms wanted to come in more, second and third-time moms wanted to come in less. And I am very clear to my patients that I think it is okay, but it's a very individual thing. So you should talk to your doctor. If you at all think that you don't want to go in, do not just cancel an appointment. Please, please, please talk to your doctor. There are circumstances where it is okay for us to broaden the schedule. Typically, you go to the hospital and you go to the doctor's office every 4 weeks until you're 28 weeks, then every 2 weeks until the end, and then every week at the very end. We have allowed our patients to stretch that out a little bit if they are low risk, if we know that they're very compliant with the things that we tell them to look out for, and if they want to. And I found, again, that some of my second or third time moms have wanted to, and I can allow some of them depending on their issues if they have any risks. Others, I can't allow it. So please just do not skip any of your visits without talking to your doctor and making sure that it is actually okay for them to allow you to do it. The other thing I wanted to address was there is constant data that's coming out. For example, people have been writing to me about what about that newborn in France? I don't know if you guys heard, but there was a newborn in France that had tested positive for COVID, but went home. Now, the problem was the mom had the baby. The baby, unfortunately, had to go to the NICU and had some issues in the brain and was found to be testing positive for COVID. Was the COVID the culprit for the issues that happened in the brain, something called gliosis? We don't know because gliosis occurs without COVID. We've seen it for many other reasons. So first of all, we don't know that COVID was the reason, and the baby went home okay. So could COVID be the cause? Maybe. In Texas, another study came out saying something like 85 infants were found to be positive, but when you really looked at the data, it wasn't 85 infants, it was maybe 85 children under age 1, and when the story came out, which I believe was Friday or Saturday, I got bombarded with messages of anxiety, when in reality, it was of a period of time from maybe March until now, that when they looked at all the data, there were 85 infants under the age of 1, not infants that were 1 month old. And so again, the initial data looked much more anxiety provoking, but those babies by and large were okay. They were just testing positive. So I really urge you guys, when you hear data coming up over and over again, please look at it very carefully, and please remind yourselves, the vast majority of people and the vast majority of times, people are okay. That does not mean that things don't occur that are deeply upsetting and deeply challenging to get through in our lives. But the majority of times we can get through them. And I just keep reiterating that because I think it's one of the most important things that we can stick with in order to kind of just get through our lives psychologically whole, okay? Can they test the baby for antibodies yet? They can test the baby, but it's a blood test, and they would not routinely do it as far as I know, unless there was a reason. Meaning if the baby had symptoms, they would do a COVID test, and they could test the baby for antibodies if mom tested positive. But again, it doesn't yet seem to be things they're routinely doing unless they're in research protocols. Okay, there was another question about due date. Due date December 13th, thoughts on celebrating Thanksgiving and Christmas with families. Oh, that's a tough one. And here's the thing, as kind of like open and liberal as I am about a lot, Thanksgiving being 2 weeks before December 13th or so, I would be cautious. Now, again, it depends on what family. My parents live next door, and so I see them. So if I happen to be, pregnant at age 50, I would see them before. But if I don't typically see them and they were flying in from another state where they were not socially isolated, I hate that word, socially distant, sorry, then I would probably not see them because, again, you don't want to run the chance of picking something up before you get to the hospital. And unfortunately, Christmas, now let's forget COVID. Let's say you had a baby on December 13th and you said, I'm going to see 30 family members on Christmas. Even Sheiva, who's very liberal about what she would allow for a lot of things for herself or her patients, would probably say, I wouldn't see 30 people with a 2 or 3 week old because forget COVID, you can get RSV and a lot of other viruses. And that's actually one of the benefits, I will tell you, to this particular coming up flu season. I think we will see fewer instances of flu and of RSV, the respiratory syncytial virus, which is a virus that can really affect babies. And many babies get infected and admitted to the hospital every year. And I bet we're going to see fewer instances of that because people are going to be more cautious. So there might be some good that's going to come from that. Another report that I wanted to tell you guys, and I find it interesting that I get millions of DMs when negative reports come out of people being like, oh my God, I'm so scared. Very few people send me messages about this positive report, which was some data out of, I believe, Denmark, about potential lower chance of preterm labor during this period of COVID. We have not seen it in many of the hospitals in the places that I talk to, a lot of the doctors, certainly not at our hospital or a lot of the hospitals in this area, but in at least 2 countries, Denmark, and I don't remember if it was France or Germany, but 2 countries, and now they're looking into it with a consortium of data in other places in Europe. They've noticed statistically significant decrease in preterm labor during this time. So there's a positive. And maybe we'll learn about preterm labor. Maybe it has to do with not necessarily working too much, because we all work a lot and it doesn't seem that bed rest improves preterm labor, but maybe the amount of extreme anxiety or exposure to a lot of other people or exposure to other viruses is what can cause it. So I do think that we have to remind ourselves that there will be some good that can come from us being more restful. Okay, 27 weeks tomorrow. Congrats with your second. We found out our sweet girl has a 2-vessel cord. Do you think a 2-vessel cord would cause major issues for our baby if I were to catch COVID? And she has asthma and she's being cautious. So first of all, congrats. Second of all, I'm glad that you're being cautious, just because I think it's good to be cautious because of the unknown. But again, I don't want you to be too anxious. Asthma, we say, is a risk factor. I'm going to give you 2 good anecdotes after this about people in our lives and who haven't gotten very sick with risk factors and things like that. So yes, you should be cautious with asthma and because you're pregnant, but I don't want you to be fearful. 2-vessel cord, just so you guys know, is incredibly common. So typically babies will have 3 blood vessels in their cord. They will have 2 arteries and 1 vein. So when you only have 2 blood vessels, you only have 1 artery and 1 vein. Is it, oh my God, terrible? No, it's really common. It is sometimes an indication that there is sometimes a chance that sometimes, again, rare, possible, maybe chance that the baby doesn't have the same growth curve. So your doctor will maybe tell you to do an ultrasound somewhere between 28 and 32 weeks to make sure the baby is continuing to grow. Should the 2-vessel cord in the setting of COVID cause any issues? They really shouldn't. I mean, there's no reason to think it would. So I wouldn't add to your anxiety about that at all. And I mean that, okay? These are the type of things that 2-vessel cord is one of those things that when we see it, we're bummed. Not because it means something bad, but because we're like, dang it, now we got to tell the patient and now we have to make the patient a little bit anxious, even though we know that the likelihood is it's not going to cause any concern at all. Even the issue with growth doesn't seem to manifest itself that often. It's just a possibility. And I said at the beginning of this, I don't like telling you what the possibilities are. I like telling you what the probabilities are. But we are groomed, unfortunately, as physicians in America to have to tell you possibilities. Lord, how I wish we didn't have to. If I could just go through my day saying to you guys, guess what? How about we just agree that I think things are going to be okay, that I'm going to take care of you to the best of the degree that I can, that we're both going to have the same endpoint in mind. And then if anything seems to be going in a direction that I don't like, or I think I need you to do any other tests, I'll have you do them. I might not tell you why. And if there's something that we have to alter, then we'll do it. That would be so great. I feel like I would decrease your anxiety. I would be able to have an easier time. I wouldn't have to talk so much and everything would just work out better, right? So, okay, that is that is that question. All right. We didn't talk about fear. I'll talk about that if I have time because I only have a couple more minutes. But the one thing I wanted to tell you guys, two actually interesting things. I'm a very exposed person. Like I'm literally at the hospital all the time, in my office all the time. And like I said before, I am not one of those crazy like Purelling all the time, but I am mindful. I try not to touch my face. I wash my hands a lot. I wear my mask when I can. I try not to be in non-ventilated rooms and really close to 1 million people if I don't have to. But as you can imagine, as an OBGYN, I am examining people all day. I'm at the hospital not every day, but many days of the week. I have A positive blood, which we don't really know scientifically if it means anything, but there seems to be some anecdotes that you are more apt to get it severely if you have A positive. And guess what? I have not gotten it. And I have been in the midst of COVID every day since we've really understood about it back in March. One of my partners who has asthma, of my 3 partners, he's the one we were worried about the most because he's a portly guy with asthma. And we know that he was exposed to it, that he had about 2 days of symptoms, that luckily nobody got it from him that we know of, and he tested positive and he's completely fine. These are anecdotes. I know there are people in the world who have not been okay. And I know there are deeply sad anecdotes of people who are young, not immunocompromised, not people that we would have predicted. But we have to remind ourselves again what is probable, not what is possible. Because if we continue to go through the world thinking of like, but what if this happens, then we will just be bereft. And we don't want that. That's not the way for us to live our lives, okay? All right, you guys, I hope that was helpful. There's always more that we could talk about. And as you can tell, I'll keep talking, but I gotta stop because I think Zoom might cut us off after an hour or so. If you are not on Instagram, then you should go on Instagram. And if you're not following me, then you can follow me on either my name, Sheiva Gohfreny, or Big Love Fierce Juju is my tag. And I like to do a lot of this kind of stuff, talking about obstetrics and gynecology, and just, again, trying to keep it where we understand that things can happen, but if we keep our wits about us, we can typically get through those things, okay? So if you have any other questions, I think that they will probably field them through Hatch, and they can always send them to me, or you can send me a DM on my Instagram. I appreciate you guys being here with me, and anything else you need, just let me know, okay? Bye.